Hi, this is Kendrick with worldmedicalschool.org. We're going to talk about hypothyroidism as part of our comprehensive clinical medicine review series. And we're also going to mention thyroiditis as it ties closely to hypothyroidism. So this is a disease that affects women more commonly than men. Women like Oprah Winfrey here, who is not looking like your classic hypothyroid patient here. She's looking pretty trim, and as we'll talk in a minute, that is not one of the major signs of hypothyroidism. But it's low thyroid hormone, and that's the basic gist of hypothyroidism is you're not making enough thyroid hormone. And this could be caused by either primary hypothyroidism, meaning that something is happening in the gland where you're not making the thyroid hormone, or secondary hypothyroidism, where you have something before the gland that is not allowing you to make thyroid hormone. For example, the most common worldwide cause of hypothyroidism would be iodine deficiency. And in developed countries, that is not a problem. So the major cause of hypothyroidism in developed countries is Hashimoto's thyroiditis. And Hashimoto's thyroiditis is an autoimmune disease caused by antibodies to thyroid peroxidase as well as other thyroid proteins. And so that causes destruction of the thyroid gland. There's other types of thyroiditis like subacute granulomatous, radiation-induced, autoimmune, which we just mentioned, postpartum, drug-induced, and hepatitis C causes kind of an autoimmune effect too. So with all of these, you are potentially going to get a hyperthyroid period where you got a lot of circulating thyroid hormone. And I guess it'd kind of be like if you were to kick a cow in the udder, for example. Sorry, this is the best thing I could come up with right now. If you kicked a cow in the udder really hard, you'd get a bunch of milk out right away. But then the udder would probably not produce milk well after that. Sorry, that's the best analogy I could think of. So in that case, you get a bunch of thyroid hormone circulating, and then after that, you get hypothyroid. So we talked about hyperthyroid in the last video, so if you have questions about that, you can look it up. But the presentation of hypothyroidism is mostly the opposite of hyperthyroidism. So because thyroid hormone speeds up metabolism and in most cases encourages growth, you get cold intolerance because you have a slower metabolism, you're not making as much heat. You get constipation because you get a slower gut. You get weight gain, bradycardia, fatigue. Everything here is slow. Muscle and joint pain. You get dry, brittle fingernails, dry skin, brittle fingernails. You get depression, hypotonia, so the muscles are weaker. Females get infertility and amenorrhea. Again, this is more commonly in females anyway. And then hyperprolactinemia, which could contribute to the infertility and can also cause galactorrhea. So those are the major early signs. Later on, you could get a goiter. You could get hoarseness, slow speech, which may be associated with the size of the goiter. You can get dry, puffy skin, especially in the face. When it gets really bad, and we'll talk about something called myxedema coma here in a second, but as it gets towards myxedema coma, you get impaired cognition, sometimes psychosis. You get hair loss, increased need for sleep, deafness, enlarged tongue. So those are some of the more serious or at least less common symptoms. This is the only picture I could find of an individual with hypothyroidism. This is a retriever Labrador with hypothyroidism. So log that away. Diagnosis is based on high TSH. Normal TSH is between 0.5 and 4.5, debatably. And some of these people get TSH levels over 100, and I hear over 1,000 as well. But a lot of these people will be symptomatic at a TSH level of 10 or even 6. So we also test low T4. So this is what T4 looks like. You just get out the microscope and look for things that look like this to measure your T4. And then you also do iodine scan, a radioactive iodine thyroid scan to see the uptake of iodine. And that will tell you how active the gland is. So you'll see a hypoactive thyroid gland. Treatment is basically just levothyroxine. It's a pretty simple treatment. Sometimes it takes a while to get your dosing right, but you give levothyroxine, and generally these people will take it for life. In subacute thyroiditis, which we didn't talk too much about, but subacute thyroiditis is often painful, and it will go away in most cases without treatment, but you can give NSAIDs and steroids to help calm it down and decrease the symptoms. Myxedema coma, as I mentioned before, is just severe hypothyroidism. You get decreased mental status, you get hypothermia. 30 to 60% of these people die. Treatment is IV levothyroxine and IV hydrocortisone if they have adrenal insufficiency. There's also congenital hypothyroidism that you need to watch out for. Worldwide, this is usually caused by iodine deficiency, but in developed countries, it may be caused by more congenital or genetic defects. For example, I believe that DeGeorge syndrome is associated with congenital hypothyroid. Treatment is levothyroxine again. And if I understand this right, and correct me if I'm wrong, but the mother's thyroid hormone will make up for the baby's lack of thyroid hormone, providing she's making enough. And so treatment is only necessary after birth. So please correct me if that's not right. But if you don't treat it, then this can develop to cretinism, which is an old term that basically just refers to the mental retardation caused by hypothyroidism in babies. So this baby on the right here is jaundice, which is one of the things that you'll see with hypothyroid, so you might want to keep that on your radar. So thank you for the pictures that we used here, for our Labrador Retriever, for a picture of Oprah, and for the baby. And if you want to get involved in the project, go to worldmedicalschool.org/volunteer. Also, your comments are very helpful in making these videos better, and please share it with your friends. Thanks.